Hello everyone, this is Dr. Navya Shetty, Professor and Head, Department of Public Health Dentistry, Sri Rajiv Gandhi College of Dental Sciences and Hospital, Bangalore. In this session, I would be talking about the topic on epidemiology of oral cancer. At the end of this session, the learner or the viewer will be able to understand the importance of epidemiology, define epidemiology, list the factors of epidemiology, discuss the host, agent and environmental factors of oral cancer. Finally, we'll be able to describe the smoking and smokeless forms of tobacco. Now, what is epidemiology all about, or why is epidemiology important? So why do we need to study epidemiology? So to define epidemiology, epidemiology is defined as the study of the distribution and determinants of health-related states or events in specified population and the application of this study in the control of health problems. So what did you understand by this definition? It says it is the study of distribution and determinants of any disease. So the key words here is distribution, determinants and control. Okay, so these are your key words to remember. Okay, so what is epidemiology? Basically, epidemiology is nothing but you are studying the distribution and determinants of any disease. It may not be just oral disease, it may be any other diseases as well. So any disease is studied under the distribution and determinants. Okay, so here what is epidemiology? It is the study of distribution. So what do you mean by distribution? You may study any disease in terms of age, gender, race, genetics, socioeconomic status, etc. So that is your distribution. Okay, so we are trying to study in which group of population the disease is more prevalent. So that was about distribution. Now what do you mean by determinants? Determinants means the causative factors or the etiological factors. So you are trying to find out what is the main cause of any disease. Okay, so by studying epidemiology, we are studying or we are getting to know the trends of diseases in a particular population, or we are studying the rise and fall of any disease in a particular population. So how is this useful? By studying the distribution and determinants of any disease in a particular population, it helps in control of health problems. So once we understand the distribution, once we understand the determinants of any disease in a particular population, when we apply it, what happens? It can help us in controlling the health problems better. Okay, so I hope you understood the definition of epidemiology. So again, to repeat, it is the study of the distribution and determinants of health-related states or events in specified population and the application of this study in the control of health problems. Now this is just to show you an example. This is findings of the study on oral cancer. So to just understand what is the role of an epidemiologist, okay, basically what does an epidemiologist do? I said they study the distribution and determinants of any disease. Distribution as in the form of age, gender, race or ethnicity, socioeconomic status, etc. And determinants as in the cause of the disease. So as you can see here, the epidemiologist has mentioned, okay, the oral cancer in terms of gender distribution over here. Okay, in terms of gender distribution. So what will you do by this? What can you achieve by this? So based on the evidence here, this data will help us in planning our preventive health programs better. Okay, so this is very, very important in creating an evidence. So this is the role of an epidemiologist. So based on this data, we can help find solutions to the problem. So how is epidemiology studied? Epidemiology of any disease is studied under the epidemiological triad. So what does it comprise of? 3 factors. It comprises of the host factor. What do you mean by host factor? Host factor in terms of age, gender, race or ethnicity, occupation, genetics, socioeconomic status, etc. So what do you mean by a host? A host means man himself. So man himself is nothing but a host. Next factor is your agent factor. So what do you mean by an agent factor? Something which causes the disease. Okay, so for example, it can be anything. It can be your microflora, it can be your diet, it can be mechanical factors, nutritional factors, etc. And the last one is the environmental factor. So what is environment? Anything that surrounds us is an environment. So what comes under the environmental factors? It can be your latitude, sunshine, geographical variations, water contaminants, industries, etc. So anything which surrounds us is an environment. So what is an epidemiological triad? It comprises of host, agent and environment. I hope you understood what an epidemiological triad is all about. Now coming to the host factors. As I said, epidemiology is studied under the host factors, agent factors and environmental factors. So under the host factors, we have age here. Okay, the first host factor is age. As I told you, host means man himself. So first host factor is age. So in this picture, you can see an old man suffering from tongue cancer. There's a lesion here. Okay, this white patch here, which you can see. So this is nothing but carcinoma of the tongue. So as you can see here, in older age groups, what is more common? Carcinomas. So carcinomas are more prevalent in the older age groups. And sarcoma, you have Kaposi sarcoma here. So what about sarcoma? Sarcoma is more prevalent among the younger age groups. Okay, so to repeat, carcinomas are more prevalent among the older age groups and sarcomas are more common in the younger age groups. So what is a carcinoma and what is a sarcoma? I'm sure you all are all familiar with. Carcinoma develops from the epithelial cells and sarcoma develops from the mesenchymal cells. Next, moving on to race. Next host factor is race. So you can see a condition here in the lip, and what is it known as? Lip melanoma. So this is more prevalent among the whites. So studies have shown more prevalence of this lip melanoma among the whites. In the next picture, you can see an adenomatoid odontogenic tumor here. So where is this prevalent? It is more common among the blacks. So to conclude, odontogenic tumors are commonly seen in blacks and lip melanoma is commonly seen among the whites. So we finished with age and ethnicity. Next, moving on to gender. So here we can see a condition known as malignant melanoma, and here we have lip cancer. So these two conditions are more common among the women. Okay, it's more prevalent among women. So here we are studying the gender distribution. So lip cancer and malignant melanoma is more prevalent among women, whereas your cancer of the tongue and cancer in the buccal mucosa, as you can see here in the picture, is more prevalent among the males. So this we finish with the gender distribution. So to repeat, malignant melanoma and lip cancer are more prevalent among women. Tongue carcinoma and cancer in the buccal mucosa is more common among the males. Moving on to genetics. We know that genetics plays an important role in the initiation and progression of any disease. So similarly, genetics is involved in the initiation and progression of malignant diseases. Next host factor is your social class. It's very common that low socioeconomic status people suffer from diseases. Why? Because of lack of affordability. So low socioeconomic status shows increase in oral cancer. The next host factor here is occupation. As you can see in the picture here, who are they? They are textile workers. And here in the second picture, who are they? They are leather workers, and especially you can see here they are males. Okay, so textile workers and male leather workers show more oral cancer. That means they are more prone to oral cancer. And who are the leather workers? Especially the males. Okay, the males. Among the leather workers, it is the males who are affected the most. So textile workers and male leather workers are more prone to oral cancer, especially in the buccal cavity, larynx and pharynx. Moving on to the next host factor, we have immunity. As you can all see, immunity. So what is immunity? Immunity plays an important role in the prevention of any disease. It is believed that children below 10 years of age and senior citizens are more prone to any infections or disease. So immunity plays an important role in the prevention of any disease. So it is one of the important host factors of oral cancer. So Kaposi sarcoma is commonly seen in HIV patients. So that was about immunity. Moving on finally to the last host factor is our customs and habits. Okay, moving on to the last host factor is our customs and habits. We all know that smoking is a risk factor for oral cancer or any cancer. So smoking increases the incidence of cancer, and there is a condition known as reverse smoking which may cause cancer of the palate. As you can see in the picture here, reverse smoking may cause palatal cancer. So this was about the smoking forms of tobacco. But apart from the smoking forms of tobacco, we have smokeless forms of tobacco too. So what do? They chew it or keep it in the mouth. So what are they? Tobacco or pan chewing. And what are the other habits? Consuming spicy food. We always say avoid spicy food. Why? Because they may lead to cancer in the floor of the mouth, as you can see in the picture here, and cancer of the buccal mucosa. Alcohol may be one of the risk factors for oral cancer. So smoking and smokeless forms of tobacco may lead to oral cancer. So that finishes with the host factors of oral cancer. To enumerate them, we have age, race, gender, genetics, occupation, immunity, social class, and finally customs and habits. So let's go on to discuss about the agent factors under the epidemiological triad. So what is your first agent factor causing oral cancer? It may be biological factor. What do you mean by biological factor? It may be in the form of a virus, as in your HIV, or fungus like your candida. Okay, so the first agent factor is biological in the form of a virus or a fungus. The next agent factor is your chemicals. So to name a few, it may be arsenic, dyes, nickel and chromium. The next agent factor is mechanical agent factor. So what do you mean by these mechanical factors? Now you can see here there's a lesion in the tongue. Why has this happened, or what is the causative factor for this? It is your sharp tooth here. And it can be ill-fitting dentures which may cause discomfort to the patient. So any source of chronic irritation, okay, like your sharp tooth or ill-fitting dentures may cause oral cancer. Next, after the mechanical factor, we have nutritional agents. What are the nutritional agents which may cause oral cancer? Precarcinogens in food. What do you mean by precarcinogens? I'm sure you would have heard of saccharin, right? Saccharin. So saccharin, precarcinogens in food like saccharin, then increased consumption of fat. Okay, so increased consumption of fat. Then what else? Protein deficiency. Then increased consumption of red chili powder. So what are the nutritional agents which may initiate oral cancer? Increased consumption of fat, proteins deficiency, or increased consumption of red chili powder, or consumption of precarcinogens in food may cause oral cancer. So far we finished discussing with the agent factors of oral cancer. So to name them or to summarize them, they were biological factors, chemical factors, mechanical factors, and nutritional agents. So we had 4 agent factors that we discussed on. Now moving on to the environmental factors. Okay, moving on to the environmental factors. Now what are the environmental factors that we have? They may be water contaminants in the form of chloroform or air pollutants in the form of carbon dioxide. See, it is not that they will definitely cause cancer. They may. It is just that they may. These are some of the risk factors that may initiate cancer. Okay, so water contaminants, air pollutants, and geographic variations as well. So any kind of geographic variations also may lead to initiation of cancer. For example, few studies have been conducted and these were the observations. So in a country called Netherlands, what did they observe in Netherlands? They observed cancer in the buccal mucosa in males. Okay, so there was more of males who have been affected in their buccal mucosa. In Switzerland, again it is males, but they were affected in the lip and tongue. Okay, so in Netherlands and Switzerland, males were more prone to oral cancer, but only the site was different. It was buccal mucosa in Netherlands, lip and tongue in Switzerland. Next, in Eskimos, I'm sure you know who are Eskimos. They live in igloos or snow houses. So you know how the weather conditions are over there. They would hardly consume any water, right? Okay. So they are more prone to cancer in the salivary glands. So Eskimos are more prone to cancer of the salivary glands. Next, moving on to the northern part of Andhra Pradesh, we have Srikakulam and Visakhapatnam. So in these places, what do we observe? Palatal cancer. So cancer of the palate is commonly seen in Srikakulam and Visakhapatnam. So again, to summarize, Netherlands, that is in Northern Europe. Okay, we see males affected in the buccal mucosa. In Central Europe, that is in Switzerland, we see lip and tongue affected in males. In Eskimos, we see cancer of the salivary glands, and in Srikakulam and Visakhapatnam, palate is the most commonly affected site. Next is solar heat. So prolonged exposure to sunlight causes a condition known as melanoma. I'm sure you all are familiar with this term or with this condition, melanoma. So nothing much to elaborate on this. And finally, the last environmental factor is industrialization. As we all know, various industries emit a lot of poisonous toxins which may lead to cancer. So to summarize the environmental factors, we have water contaminants, air pollutants, geographic variations, solar heat, and industrialization. So this finishes with the epidemiology of oral cancer under the epidemiological triad, as in host factors, agent factors, and environmental factors. Next Next, you need to know the smoking forms of tobacco and the smokeless forms of tobacco. Okay, so what are the smoking forms of tobacco? You all know BD. BD. Okay. BDs are most popular in India. I'm sure all of you all know that. Okay. BDs are most popular in India. Next we have cigars here. Cigars are also known as chutta. So what are the smoking forms of tobacco? BDs, which are popular in India. Cigars, which are known as chutta. Next we have chillam. Here you can see an old man. Okay, he is holding this long conical clay pipe vertically and he is smoking. Okay, he is using this chillam for smoking here. So what is chillam? It's a straight long conical pipe used for smoking tobacco and is held vertically. Okay, so this is about chillam. So this was one of the smoking forms of tobacco. Next we have cigarettes. This is very common. Okay, cigarettes is very common. So what are cigarettes? They are tobacco cured in sun or artificial heat covered by paper. It is treated with sugars, flavoring ingredients, and they trap less nicotine. Next we have dhumti. Okay, next we have something known as dhumti. This, as you can see here, this is a woman. Okay, she is using this for reverse smoking. So she is using dhumti for reverse smoking. Okay, so where is it commonly seen in? It is commonly seen in Goa. Okay, it is commonly seen in Goa. And what is this dhumti? It is a rolled leaf tobacco which is used inside a leaf of jackfruit tree. So this was about dhumti. Okay, so what is dhumti? Dhumti is popular in Goa. It is commonly seen among women. And what is it? It is a rolled leaf tobacco which is used inside a leaf of jackfruit tree. Next, coming to hookah. Okay, next coming to hookah. This is hookah. It is a water pipe or it's called as hubble bubble. Quite amusing. What is it? The tobacco smoke is drawn through the water in the base of the hookah which cools and filters the smoke. So this was about hookah. Now finally we have hookli. Now what is hookli? It is a clay pipe with short stem with a mouthpiece and a bowl. Okay, it is a clay pipe with short stem, mouthpiece and a bowl. So where is it common in? It is common in Bhavnagar district of Gujarat. We said dhumti was common among women in Goa and hookli is common in Gujarat. So this finishes with the smoking forms of tobacco. So to enumerate, it is BD, chillam, chutta, cigarettes, dhumti, hookah and hookli. Next, moving on to the smokeless forms of tobacco. Okay, we are moving on to the smokeless forms of tobacco. So what is the first one? Khaini. You can see this khaini here. Okay, so what does it contain? It is a powdered sun-dried tobacco slaked lime with arecanut. So as you can all see here, it is a powder of tobacco, slaked lime and arecanut. So it consists of 3 ingredients, khaini. So it is placed in the mouth or chewed, seen commonly in Maharashtra. Okay, so this is commonly seen in Maharashtra. So I hope you understood what khaini is. It consists of 3 ingredients, that is sun-dried tobacco, slaked lime and arecanut, commonly seen in Maharashtra. So that was about khaini. Moving on to the next smokeless form of tobacco is Mainpuri tobacco, which is commonly seen in Uttar Pradesh. Okay, commonly seen in Uttar Pradesh. Again, this is a mixture of 3 ingredients, tobacco, slaked lime and arecanut. But the only additional ingredients are camphor and cloves. Okay, camphor and cloves are the additional ingredients apart from khaini. So I hope you understood what is khaini, which is popular in Maharashtra, and Mainpuri tobacco, common in Uttar Pradesh. Next, moving on to mawa. Now here, this is an important term, shavings. Okay, so mawa means shavings. It consists of shavings of arecanut with some tobacco and slaked lime. Okay, it consists of shavings of arecanut with some tobacco and slaked lime. So you can see the three ingredients here: arecanut, slaked lime and tobacco. But what are they? They are a mixture of shavings. Okay, it's not a powder, it's not in a powder form. It is a mixture of shavings. Next, moving on to mishri. Now what is mishri? You can see this black powder here. So what is it? It is roasting of tobacco on a hot metal plate until it is uniformly black. So how is this black powder prepared? It is prepared by roasting tobacco on a hot metal plate until it is uniformly black. Next we have pan. Okay, pan. Pan, you all know, it is a mixture of arecanut, lime, cardamom, cinnamon, cloves, sugar and tobacco wrapped in betel leaf. So I hope you understood pan. And finally, we have snuff, which is the last smokeless forms of tobacco. Okay, so it is finely powdered, air cured and fire cured tobacco leaves. It's in the powdered form, carried in a metal container. And how is it applied? A twig is dipped into it and applied over the tooth and gingiva. Okay, so this finishes with the smokeless forms of tobacco. So to summarize them, it's khaini, Mainpuri tobacco, mawa, mishri, pan and snuff. So what did we all learn today? To summarize, what did we learn? So let's summarize it. We studied the importance of studying epidemiology of any disease. We studied that the epidemiology of any disease can be studied under the host, agent and environment factor. And finally, we learned to describe the smoking and smokeless forms of tobacco. So to repeat, we studied the importance of epidemiology. How do we study a disease? Under the host, agent and environmental factors. And what are the smoking and smokeless forms of tobacco? So what are the expected questions in the exams under the Rajiv Gandhi University of Health Sciences on this topic? The first one, define epidemiology. Next, explain epidemiology of oral cancer under the host, agent and environment factor. And finally, the last question is, describe or list the smoking and smokeless forms of tobacco. So that finishes the discussion on epidemiology of oral cancer. I hope you all had a good learning experience and will continue to do so through this video of mine. Thank you.